My name is Dr. Davis Adeje. I'm a consultant obstetrician and gynecologist, and the medical director of Mary Lucy Hospital, Lucy Memorial Hospital, and Royal Medical Diagnostic Center. We specialize in various aspects of gynecology and obstetrics, but also, more importantly, in assisted reproduction, and in particular IVF. IVF is the short form of in vitro fertilization. Now, in vitro means outside the body. So we fertilize the female egg outside the body and introduce it inside the womb. Now, under normal circumstances, when an egg is released from the ovary, that's in the female, and then the sperm on its way through the vagina, through the womb, into the fallopian tubes, one sperm will meet the egg and penetrate it to fertilize it. And that's a process we call fertilization. And so we try to do this process outside of the body because the circumstances, or depending on what the circumstances of the patient is, to warrant this procedure. So when this process happens, it means there must be an egg and there must be a sperm. And therefore, and also in a normal situation, every month, the female usually produces one egg. And so the chances of fertilizing is based on one egg. What we seek to do in IVF is to stimulate this patient or a patient's ovaries to produce more than one egg, several eggs, and then we try to fertilize them through various means, either mixing it with the sperm for the sperm to penetrate, or sometimes actively introducing the sperm singularly into the egg. So once the fertilization has happened, then it has to go through a process of incubation or culture to get to the stage where it will be transferred. In these days, in the blastocyst stage, which is around 5 days after the fertilization. But of course, there are the less popular one that used to be 3 days after fertilization. Now, this process is just a simplified version of what happens in IVF, but it is a lot more complex than it is. Now, we give special drugs to the female to force the ovary, as it were, to produce many eggs, so as to boost the chances of the fertilization, because not all the eggs will be of sufficient quality, because the eggs must be of a certain stage or quality to be able to get fertilized. And so when you get more eggs, then you're boosting the chances of the number that will be fertilized. Then, of course, after fertilization, they have to go through that process where the incubator and cultured. And of course, during that stage, not all the fertilized ones will make it to the stage of transfer, which is usually day 5 or 5 days after fertilization, or in some cases 3 days after the fertilization. Now, when the embryos have been formed through this process, then we can either transfer them on the day, which is at that stage, which is 5 days after the fertilization, or 3 days after the fertilization, which is the less common approach, or it is frozen entirely for various indications. Frozen means it is kept cryopreserved, we call it, and then at a later date, the transfer can be done at the convenience of the patient, or depending on the medical circumstances or situation, or even in some cases as a routine procedure, because the chances are just that little bit better. So in a nutshell, this is what the IVF process is about. There are various ways of going about this to optimize the chances. For example, the process of IVF on itself may become necessary because of certain factors. One, i.e., maybe the patient's fallopian tubes are blocked, and so that process of fertilization cannot happen because where it happens, which is the fallopian tube, is blocked. So that creates a barrier between the egg and the sperm. In some situations, too, it could be that the patient's eggs are weak and therefore needs that extra boost of stimulation with higher doses of drugs to get some eggs out of the patient. In some situations, it could be the male factor, the male side issues with sperm also. That will necessitate the procedure. So here, now let us take the various aspects of IVF where things where things were not right in the first place to necessitate IVF. Let's take the female for in the first place. If a female or a lady diminished, what you call diminished ovarian reserve, it means the eggs are diminished either as a result of her age or sometimes just due to various factors. The eggs are the ovaries are diminished in terms of the quantity and the quality of eggs that she has. Now, the IVF procedure or process involves stages. The stage of stimulating the female to get more eggs. The sperm must be of the right quality, and then the sperm must penetrate the eggs. And then, that's fertilization. After fertilization, the fertilized egg will develop into the embryo, and that will have to then be put inside the female's womb. Now, the lining of the womb, we call the endometrium, must be receptive enough for the embryo to attach, and we call that process implantation. Now, what it also means is that even though IVF is to give the opportunity of pregnancy, the processes are such that IVF on its own is also not 100%. So, depending on individual circumstances, the results can vary. So, when somebody asks, what is the success rate of IVF in this center, then what I ask is, it is not fair to judge results just based on how many pregnancies. In fact, it varies from an individual to an individual. So if I have a 42-year-old lady, her results are not going to be the same as somebody in the 30s, early 30s, for example. I can have a patient with very terrible lining of the womb. Her results is, even if she's young, her results is not going to be as good as somebody of the same different age with with good lining of the womb. So there are several factors that come into success issues. So I prefer that success should be on individual basis rather than trying to say the success rate of this center is this. The center may be dealing with very young people. People, of course, will have a higher success rate. A center dealing with predominantly women in their 40s is going to have a different success rate. So you can't compare the two. But anyway, the bottom line is things can go wrong or things can prevent things from going right during the process. So let's look at the various stages. Now, if the female has not got enough or eggs in terms of quantity and quality, then that could be an issue, because if the egg is not of sufficient quality, then that process of fertilization that we are talking about cannot happen. So what do we do at Mary Lucy Hospital to enhance the processes, such as poor quality egg, quantity, low eggs, even poor, low sperm, endometrium or the lining of the womb that is not right. So everything being perfect, you've got your perfect embryo. Put it in the womb, but at the end of the day, it still doesn't stick and stay to develop. So we have introduced stem cells into the IVF processes or procedures, depending on what the problems are. So we determine where problems are. If it's poor egg quantity, quality eggs, then of course there's always the option of donor eggs where somebody's eggs can be used. But of course we can also do the stem cell or ovarian stimulation of the individual's ovaries to get quality and more quality eggs. That is ovarian stimulation. Now, on the male side, again, there are some patients who have very poor, low quality sperm that cannot perform. Then we can boost that as well with stem cell. So we have stem cell or cellular treatment enhancement of the male sperm problem to create to get good quality sperms for the procedure. Now, how about the womb itself? The womb may have other issues or several issues, such as the lining, the inside of the womb being of, it's like a soil. If you're going to, sow a seed, then the soil must be of good standard quality for the seed to germinate. So if you have a lot of forest, bush, rubbish in the soil, then the chances of that seed germinating is very low. So what do we do in this case? We have a look inside the womb and we clear the inside of the womb. That is, as it were, clear all the bush, the rubbish that you don't want, and then we fertilize the soil. So we call that rejuvenation of the endometrium to make it more receptive to the embryo. So that is endometrial rejuvenation. Sometimes there are fibroids and things that distort the inside of the womb, or for that matter, the womb also, to make it less likely for an embryo to implant. So during the fibroid surgery, we can also work on the lining of the womb to improve the chances of embryo implantation of the embryos. Now, these are just some of the things that we do with the help of cellular-based treatments, called stem cells. Now, these are cells that these are not cells that we import from anywhere or that is derived from any source, but we're talking about the individual's own stem cells using to enhance this process. Because after all, that's how God created us, to heal ourselves when we have issues, when we have problems, such as, for example, if you sustain an injury, a cut. Okay, so when you come to hospital and we stitch it, or we dress it, or we give you antibiotics, antiseptic to clean and all that, that is not what actually mends the skin or the healing. That is just to prevent germs from contaminating the wound and therefore preventing the healing. But the actual healing process, where the skin mends, comes together, heals, is done by the stem cells. And so if you can harvest these stem cells and introduce them into an area where there is a problem, such as in terms of reproductive issues, then there is a high chance that it can elevate the function of that tissue or organ. So stem cell, we have inculcated it into our IVF procedure, and it's making a huge difference. That is what we do here at Mary Lucy Hospital to enhance the success rate.